Well, if I go back to 20 years ago where we started using the intraoral camera, the patients were amazed to see what we are seeing and what we are showing to them. So with digital dentistry, I think the big changes with the CBCT, with the intraoral scanner, it has changed a lot. With CBCT, we can show the patient the quality of the bone, how is the bone, what is the possibility of placing an implant, combined with the intraoral scanner to avoid the impressions and integrate both of them together so we can explain really to the patient what what we can do and what we expect. Initially, we started with the CBCT and then we moved to the intraoral scanner. Patient communication is amazing. That patient can understand and feel more comfortable to have the treatment and higher acceptance also. And with the time, we can show the patient how things will be also at the end result. So even communication with the lab, visual models, CAD/CAM technology has to improved a lot. So patient, lab, dental communication, that's helped a lot. Initially, we'll do the CBCT, we'll have the DICOM files, and then we'll have the intraoral scanner. So we have the STL file sent to the lab. The lab supposed to have the same platform, or at least a compatible software that can be read all those information. Now there is many software in the market available. For example, I'm using Co-Diagnostic to do the surgical planning, to do the guided surgery. Also, there is a possibility to place the prosthetic part either at a temporary level or as a final level. SmileCloud has helped us a lot also to communicate with the lab, understanding in real time between we can communicate on an open platform that we both together on the same level, so we can see what he's seeing and we can explain to each other what we need. So that saves us a lot of time for the surgery protocol, a lot of time to get the end result. And also sometimes we can share the patient with us so he can see what the expectation that it will be. And definitely with the lab, we can ask him to do the mock-up as a start and do some trial before we do the final process or the final treatment. But at the level of the implant, definitely guided implant with the lab, the planning, the whole planning, because it's not only about the surgical, it's the prosto-driven. So if the lab is not involved 100%, we cannot get the optimal result that we can give to our patients. I think the future is very positive with all the technology coming and the improvement of the technology. The only point I think it's the prices. So with the time, those are expensive equipment, but with the time it's getting better and maybe cheaper. So company need to think about having this technology available for all the dentists, not for just one part. So for all the dentists to be able to use the digital dentistry, because everything is driven now by the technology and by AI. Even the implant, eventually maybe it will be like, now we are doing the static implant positioning for all their cases. This depends on the future development, AI and all the diagnosis tools that we have in our hand now.